Hello everyone. So now our topic for today will be concepts of designing removable partial denture prosthesis. We need to know when we are designing a removable partial denture prosthesis that there are different kinds of concepts that come in picture while we are putting a rest, while we are giving a direct retainer, while we are giving an indirect retainer, or we are giving a rest seat, where it has supposed to come, how much area are we supposed to consider for fabrication of removable partial denture. It was first expounded by A.H. Smith in the year of 1956, which was then accomplished with the help of his own studies that the mechanical and the biological principles were also applied. So as we now know that the functional impression is also important for a two-tissue supported removable partial denture, this enables the teeth and the soft tissue to withstand those forces and place during that of the functioning. Now the basic principles that came across were three different physiologic designs, that is stress equalization, physiologic basing and broad stress distribution. Stress equalization, that means according to this concept that the compressibility and resiliency of the tooth, periodontal ligaments and the mucosal tissue is very much different. Now it causes an unequal distribution of stresses onto the abutment teeth and the alveolar ridges, resulting in weakening of the abutment teeth. So it advocates its use of stress director, or we can say a stress equalizer, or also known as stress breaker. Now because of why? Because the mucosa, we know that it is 2 mm resilient, whereas the periodontal ligament is only 0.25 mm resilient. So what exactly is a stress breaker? It is a device which relieves the abutment teeth of all the part of occlusal forces. That is called stress breaker. Now what are the advantages of this? Now equal distribution of stress between the abutment teeth and the residual ridge was happening. The alveolar support of the abutment teeth is also preserved. Movement of the denture base, that is producing a massaging effect onto the tissue like a tissue conditioner, avoids frequent need of relining and rebasing, and it was providing a rotational movement of the denture base, of course. Coming to the disadvantages of the stress equalization, that was complicated in design. It increases the residual ridge resorption. It makes the assembly very weak. It counteracts only vertical forces and no horizontal forces for that matter. And most important, it was expensive. Coming to the next theory, that was physiologic basing. Now this theory dentists use of stress breaker in the removable partial denture. It advocates use of functional impression produced to record a tissue in its functional form. Now it will compress the tissue even at rest. So the occlusion loading can't compress the tissue more further. Due to the rebound action of the mucosa, it will position the artificial teeth above the occlusal plane. Now, so the advantages were, it was very simple in design, good adaptation to the underlying mucosa which is present, minimal direct retention was required, and it decreases the functional stresses onto that of the abutment teeth. Coming to the disadvantages of such kind, the tissues are always in a state of compression. It increases the rate of resorption of the ridge. The denture teeth are always slightly above the plane of occlusion, and it also causes instability of the denture because of the plane of occlusion was hampered. It does not provide any stability against the lateral forces. So that was all the disadvantages of physiologic basing. Coming to the other one, that is broad stress distribution. It advocates that the use of maximum support tissue area and maximum number of teeth for even distribution of stresses. It is achieved by use of additional rest, direct retainer, increasing denture base area. That is how broad stress distribution, like you can see in this my case here, this case which is taken over is attributed such a big palatal coverage, and this is giving a broad stress. I told you broad stress distribution is advocated in a small principle that is called a snowshoe effect, where the shoes are very big, surface area is increased, so stability is also increased. Now advantages, it reduces the forces on the abutment teeth. The health of the oral tissue and the abutment teeth is as well maintained. Additional rest seat or direct retainer reduces lateral forces onto the abutment teeth, and it also acts as a splint. There has to be some disadvantages with broad stress distribution as well. You can see such a big area is covered, so oral hygiene maintenance is very difficult. Due to greater amount of soft tissue coverage, it causes discomfort to the patient as well. So what are the essentials of designing, key factors for designing any any partial dentures? So for the key factors that were responsible were the direct retainers, the indirect retainer, the rest seats. All these were the requirements of the removable partial denture. Coming to tooth tissue supported removable partial denture, class 1. The abutment teeth are situated anterior to the edentulous area. It receives support from soft tissue and the remaining teeth. Of course, careful consideration when designing is to be done. Principles for class 1 removable partial denture, bilateral distal extension cases for class 1 and class 2. Now we need to see that what are the different designs that we have to advocate for fabrication of a removable partial denture in cases of class 1 design. So the different designs that we have to come across is, so the different designs for principles for class 1 removable partial dentures, that is a bilateral distal extension cases for class 1 or class 2 for that matter. First we will see the clasp, how it should be. At least 2 clasps should be present on the terminal tooth are sufficient. For distobuccal undercut, a vertical projection clasp is indicated. For a mesiobuccal undercut, a wrought wire or a combination clasp is indicated. Always remembering distobuccal undercut, projection, vertical projection clasp. May it be I bar, I clasp or Y clasp or T clasp. Whereas mesiobuccal undercut, if it is present, then a normal wrought wire, that is the combination clasp, is utmost important. Reciprocal arm should be rigid, can also be replaced with lingual plate. For class 2, for say, a clasp, usually 3 clasps are designed. The distal extension side can be designed similar to that of class 1. Reciprocal arm should be again rigid. Whereas coming to the rest, how the rest should be. For maximum possible support, we have to find the rest. Designed for the direction of the stress in the direction along the long axis of the teeth. Should always be placed on the tooth adjacent to the edentulous area. But which side? Mesial or distal? It should be in the mesial side. Coming to the indirect retention. Now location, it should be as far as from the fulcrum line. So it should be nearer to the anteriors. 2 indirect retainers for class 1 situation, because there is no 90 degree, it will go up to 45 degree, we know that. And on the opposite side as the edentulous area in class 2, only one is sufficient. Lingual plate with the rest seats is an efficient retainer in these cases. Coming to the next, that is a major connector, how it should be. Importantly, major connector, it should be rigid and it should not impinge on the soft tissue. The maxillary support from the hard palate should be taken wherever possible. For the case of mandible, the lingual plate for increased rigidity is to be considered, and indirect retention and elimination of the areas of food impaction should be done. Coming to how should be a minor connector, importantly rigid, again position to enhance comfort, cleanliness and placement of an artificial teeth. Coming to occlusion, centric relation and centric occlusion should coincide in cases of class 1 or class 2. Artificial teeth should be positioned to reduce the stress. The position to enhance the comfort, direction of the stress should be always on the long axis of the teeth, which should be efficient in mastication. Now coming to the denture base, how it should be. A denture base should be broad coverage for equal stress distribution. That is, the borders should not interfere with the functional movements of the tissue. Selective pressure technique is indicated for edentulous spaces. Coming to how should be, see, these are all examples of class 1, this is class 2. We can see broadly anterior-posterior palatal strap is given. We can see the number of rests which are there. We can see the direct retainers that is being planned. And coming to class 3, the clasp. How should be the clasp design? Quadrilateral design should be there. Class 3. So 1, 2, 3, 4. This should be a quadrilateral design. Type of the clasp is not critical here. The selection depends on consideration of the tooth and the aesthetics. Bracing arm should be rigid. And most important for class 3 is the rest position. Should be placed on the adjacent abutments and it should support the major connector. Whereas an indirect retainer not usually required when we are considering class 3. Major connector, minor connector, same requirement as class 1. Occlusion also remains the same as that for the class 1. Denture based functional impression is necessary for class 3 because class 3 is what? Class 3 is tooth supported. We do not require a functional impression. So here only the extent of coverage should be determined by appearance, comfort and avoidance of the food impaction. The main basic aim here should be food impaction should not happen. If that is maintained, rest all oral hygiene is maintained, everything else falls into place for class 3. Coming to class 4, kind of restoration where the removable partial denture design, clasp how it should be quadrilateral again because quadrilateral clasp design will give more stability to that particular removable partial denture. Location should be as anterior as possible to the adjacent to the edentulous area, as far as posterior to the fulcrum line as possible. So 2 as close, 2 as far. So that will give a quadrilateral effect onto the clasp design. Type of the clasp is again not crucial here for class 4. Yes, where is it crucial? For the anterior display. So projecting a vertical projection clasp is much better, which should not be displayed from the anterior region. And nowadays we do not have metal vertical projecting clasp, we have ceramic vertical projecting clasp as well. Selection depends on consideration of tooth and the aesthetics for that matter. For considering major connector, how should be a major connector? It should be rigid, broad coverage should be considered. Like for example, maxillary, the palatal coverage should be entirely covered. Indirect retainer, how it should be? It should be located as far as possible from the fulcrum line to gain maximum stability. So these are all the considerations that we do for fabrication of the removable partial denture for class 4 prosthesis, or the entire designing based on that. See, we see quadrilateral nicely placed, 2 rest here, 2 at the end, clasps placed here and 1 posterior most. So this is making a quadrilateral kind of appearance. We can see a broad palatal coverage which is given. So this is also fulfilling our requirement for the major connector. Hence these are the different types. This is a mandibular anterior class 4. We can see it is all fallen into the requirements of our framework design. Thank you.